my name is Mac Pate, and this is my Child Health Issues Final Project presentation. So first, just an overview of the state of Alabama. There are 67 counties in the state of Alabama, and we have a mix of rural, suburban, and urban counties. Some suburban counties of note: Shelby County, Hoover, those areas. More metropolitan urban areas include Montgomery, the capital, Birmingham, Mobile, and Huntsville. And then some rural counties include Bibb, Greene, and Perry counties. So Alabama has a population of 4,903,185, and the number comes from July 1st, 2019. So it might have fluctuated just a little bit. Of that population, 31.4% were 0 to 24 years old, and within that group, 6% were under 5 years old, 6.1% were 5 to 9 years old, 6.3% were 10 to 14 years old, 6.4% were 15 to 19 years old, and 6.6% were 20 to 24 years old. And then for the entire population, 15.5% of Alabamians lived below the poverty line, and that's actually 5% higher than the national average for that year. My next section is on some specific issues that children and families, specifically mothers, face within the state. So the first one I want to talk about is poverty. Poverty is a significant social determinant of health. It's an economic status really affects health outcomes and wellness. So the ability to acquire nutritious food, weather-appropriate clothing, secure housing, reliable transportation, and healthcare services, all of those greatly impact an individual's overall health and wellness. And being in a state of poverty is to be unable to afford any or all of those resources. Additionally, some secondary effects of poverty include a lack of access to educational opportunities, increased stress, and outlets for exercise and recreation. And those kind of show more the byproducts effects of poverty, wherein you feel more of a mental load. You don't have as many outlets for recreation due to a lack of free time if you're always working or you're unable to afford recreation opportunities, or you don't have access to educational opportunities to potentially improve your social standing or your financial prospects. So children and those who live in rural communities, especially Black and Hispanic people, are disproportionately affected by poverty. So we have a statistic: 37% of Black women in the rural South live in poverty. And children are the largest age group to be impoverished, which can have a pretty significant effect on their health as children and their health outcomes for the rest of their life. But as children, being impoverished can affect a child's birth weight, infant mortality, language development, chronic illness, environmental exposure, nutrition, and injury. And even more alarming, that there is a proven link between child abuse and neglect and poverty. The next issue I want to talk about within the state of Alabama is abortion access. So this year in 2020, Roe v. Wade was overturned, which returned the issue of abortion legality to the states. Alabama has since made all abortions illegal, including in the case of rape and incest, and the only exception to this is with a doctor's approval to save the mother's life. So only in the case where the mother's or the pregnant person's life is in fatal jeopardy can an abortion be performed. This is pretty significant for the state of Alabama because 51% of our population is female, and abortion, while pregnancy can happen to people who don't specifically identify as women, there's not a lot of research done on the link between non-women people who are able to reproduce and abortion. So my argument was that for those people, having a wanted abortion when they want to be not pregnant may indeed be gender-affirming care in addition to reproductive health care. According to the textbook, abortion is one of the most common medical interventions in the U.S., with 1 in 4 women having an abortion by age 45, and that's a pretty high rate, especially for a state with a population of over half being female. Contrary to pro-life or anti-choice rhetoric, abortions are actually safe and effective. There is no link between having one or multiple safe abortions and decreasing future fertility. There's no link between having an abortion and increased chances of breast cancer. And in fact, being denied a wanted abortion can put a significant strain on a person's mental health, including added stress or depression. Having abortion access is a step towards reproductive justice. Reproductive justice is an all-encompassing term that includes adequate wages, secure housing, reliable transportation, workers' rights, prison reform, and educational opportunities, as well as like safe communities. So part of that is that the choice to become a parent or when to become a parent is part of reproductive justice. And so having access to an abortion, having access to medical procedures that allow people to choose the circumstances in which they become parents or to choose not to become parents is part of that struggle towards reproductive justice. And the state of Alabama struggles in a lot of those areas that reproductive justice focuses on. So we could definitely improve our stance on reproductive justice by decriminalizing or making abortions legal again. So social determinants of health can be a bit of a confusing term, but according to Koch, it is the conditions in which people are born, grow, live, and age. And the textbook actually gets that definition from the World Health Organization. Put simply, social determinants of health are all of the non-choice factors that affect a person's health and wellness. So for example, choosing to eat a well-balanced, healthy diet is an individual choice, but having access to a variety of healthy foods at a cost that an individual can afford, that is a social determinant of health. The textbook lays out 6 main categories for social determinants of health. They are economic stability, which includes income, employment, debt, neighborhood and physical environment, which includes transportation, housing, walkability, and parks, education, which includes literacy, early childhood education, and higher education, food, which includes hunger, and access to healthy options, community and social context, which includes discrimination, stress, support systems, and community engagement, and the healthcare system, which includes health coverage, provider capability, and cultural competency of providers. So all of these factors, while are not all individual choices, it's an individual choice to have a personal car or to take a bus to work. It's not a choice, the economic conditions in which you can afford one or either of those options. Additionally, it's not a choice if where you live is not walkable, or if there's no public transportation offered, or if the schools that your children attend aren't, they don't perform as well in schools in different areas. So all of these factors play an implicit part in a person's, and especially a child's development of their health and wellness. Now you can address social determinants of health. Policymakers specifically can address them, and practitioners. Policymakers would be more focused on upstream interventions, and so upstream interventions are going to focus on creating policies that address these social inequities and budgeting allocations, whereas downstream interventions is going to be more hands-on providers who are making sure they're culturally competent, helping their clients access healthy food options, helping them get to and from work, helping them find a job that supports their lifestyle and that fits their budget. So those are the 2 kind of different interventions for social determinants of health that social workers focus on. So specifically for the state of Alabama, the state is addressing several of these inequities that are social determinants of health, and the 2 that I chose to focus on were food insecurity and housing assistance. So food insecurity is an economic condition where individuals do not have access to an adequate supply of food. Even more so, food insecurity is where individuals don't have access to a variety of options that give them the option to live a healthy lifestyle. Some of the effects of food insecurity can include binge eating, malnutrition, and mineral deficiencies. And take a moment to talk about binge eating. It would seem contradictory that binge eating would be a side effect or a consequence of food insecurity, because having a lack of secure food seems opposite to eating a surplus of it. But really, that comes from a place, a more survival instinct of needing to overeat in the fear that you won't be able to eat again at another point, which again is not healthy for the body and can cause health implications. So Alabama is ranked 6th in the country for food insecurity, with 16.3% of households classified as food insecure. And certain groups and certain demographics are more predisposed to becoming food insecure, which include low-income households, households with children, especially those that are single-parent households, single-person dwelling homes, and African-American/Black and Hispanic households. Housing assistance. Primarily, housing assistance takes the form of financial assistance, public housing, and housing choice vouchers. And this is a pretty specific issue for the state of Alabama because as of January 2019, it was estimated that over 3,000 people experienced homelessness on any given day. And 19.1% of Alabama households had what was classified as a high-cost burden mortgage. A high-cost burden mortgage is where over 1/3 of a household's income is going towards rent payments or mortgage payments. It's actually suggested by financial advisors that the maximum you spend on your housing is 1/3. So for almost 20% of Alabama's housing, for it to be over 33% of their income to be allocated towards housing, puts them in a position of jeopardy to potentially become unhoused, which is why Alabama continues to allocate resources towards this issue by providing financial assistance, public housing, and housing choice vouchers. So I noticed that Greene and Perry counties are disproportionately affected by both issues. For more statistics on that, please refer to some of the references below. So here I have an example of a social ecological model with the case study of childhood vaping. So at the most personal level, the individual having negative attitudes towards vaping or knowing about the harmful effects of vaping would negatively influence a child to vape or encourage them not to. At the next level, the interpersonal, the friends, the family, the peers, parents who smoke or vape or vaping being seen as cool by peers may positively influence a child to vape, meaning they would choose to. The next tier up is the community level. So having a school program which offers information about the effects of vaping, or community centers becoming smoke-free zones, both of those would negatively influence a child to vape. Then there's the organizational level, wherein tobacco companies, at the organizational level, I have both positive and negative effects or influences to childhood vaping, So tobacco companies choosing to use brightly colored packaging and offering kid-friendly flavors, that would positively influence a child to vape by encouraging it. Whereas on the other hand, health insurance policies not covering smoking-related health conditions would negatively influence a child to vape. At this level, it's a bit more broad, and less direct, less personal than the community, interpersonal, and individual levels are. So this is a level that's specifically for children. Parents, guardians, and community leaders would want to talk to children about how they're being influenced or encouraged or dissuaded by these unseen factors. And finally, the policy is the highest level because it creates the boundaries for the others to operate within. So after studies came out about the harmful effects of vaping, the Child Nicotine Poisoning Act and the FDA deeming rule both were instilled, which negatively influences children to vape, and banning the sales of tobacco products and e-cigarettes to people younger than the age of 21, offering free samples, and having tobacco products placed within vending machines, making them less accessible, also negatively influence children to vape. So you can see how each layer trickles down to influence the next one, with the policy being the broadest and the individual being the most personal or the most influential to that individual's actions. So the social and ecological model, it is categorized by having a few different layers, with the most personal being the individual and the most broad being policy. The individual layer describes the beliefs, attitudes, and knowledge that an individual has that will affect their decisions or influence their actions. The interpersonal level is the people around the individual, so that's going to be the relationships an individual has, which will influence their decision. On the example shown, I have it being peers and family members. The community level is a little less influential because it represents non-human endorsements, but it does still have a direct impact on the individual's actions, because it is still in their world. It is something they interact with personally. So in the example, I have listed community centers and schools. The organizational level is a bit broader and has a less pronounced impact, but the organizational level does more to encourage or discourage certain actions without having a direct influence or impact by directly interacting with the individual. So for the organizational level, I discussed how marketing and product endorsement may encourage usage of tobacco products to children, and how health insurance policies may dissuade children to use tobacco products. And then finally, the broadest or the highest level of the social ecological model is the policy level. And that's because the policy creates the limits for which all other layers can operate within by setting the standard of legality. So it's easy to see when you think about it as a tiered system how the policy being at the top trickles down, and each layer trickles down to the individual. And from that, the individual, the closest layer, can influence that same individual's actions. So that's how the social ecological model works. These are my references. I really hope you enjoyed my presentation, and I hope you learned something today. Thank you.